Welcome, everyone. Thank you for joining us today for our monthly Strengthening Families webinar. Today, we're focused on community conditions that strengthen families, and we are very excited about how many people registered to join us today, and great to see you all streaming through the doors here. We are very glad that you're here. We've structured today as a 90-minute call, and as you may be able to tell, we're in Zoom meeting mode rather than a webinar so that we can do some more interaction than we typically do on webinars. And we're excited to jump in. So I see those numbers of participants still climbing as people get in, but I'm going to go ahead and get us started so that we don't lose any of our time today. We actually want to start with a poll. And I'm going to ask my colleague Jang to put up the poll asking if you remember, if you responded to the survey that we put out about community conditions in February to April of this year. We did include a maybe option because we know that 2020 has been quite a year and I don't remember what I did in April. Totally understand if you don't either. But we kind of wanted to get a sense of how many of those of you who are here today are also among the voices that we're summarizing when we talk about who responded to the survey. Looks like so far, we'll leave that open for a little bit longer, but so far it's looking like most of you either did not or aren't sure, which is totally understandable. So far, just 5 of you who say that you definitely did respond to that survey. So I believe you can see the results now. Just 5 people who did respond, the majority who didn't. And so actually that's fantastic because our reasoning for doing this webinar was that we know we didn't get everybody's perspective in the survey, and we wanted to have other opportunities and other ways for people to connect to the conversation so we can hear what you're working on and what you're thinking about and what your needs are. So, all right, with that poll done, we will move along. Just a little bit of context before we get into our topic today. We do these webinars once a month. It's an open invitation to anyone who's using the Strengthening Families Protective Factors framework or coordinating Strengthening Families work in your state or your community or your program. We jointly host these between the Center for the Study of Social Policy and the Children's Trust Fund Alliance. And you'll see Jang just put in the chat box the link to where all of the recordings and PowerPoints and handouts are all archived from many years of these webinars if you go to that link. And if you miss a call, you can always go look and see what's new there. Or if you are curious about a topic that we might have covered in the past, you could go and look for it there. Lots of rich material there. We have been doing these the second Thursday of each month at this time. Typically it's an hour. As you know, we are playing around a little bit with the length and interaction style and all of that. So I actually have a survey out right now about that, and that Google form link is there. We are curious to know what you get out of these webinars, what you're looking for from them, and please take a few minutes. It's a quick survey just to let us know what you like and what you prefer as we shape the calendar for next year. We do have one scheduled for January. It'll be an hour long, more of our traditional format, and it is called Community Development and Early Childhood Partnering for Better Outcomes. So you'll get to hear about a project where we paired housing and community development folks with their early childhood system building partners and communities to better serve the families with young children who were living in the community development the housing developments that those organizations run. So you'll be able to hear about that in January. You can register now or keep an eye out for newsletters and other invitations to register for that. You can always look on our website at cssp.org to find our upcoming webinars. All right, so for today, we are going to be talking about community conditions that strengthen families. And I'm very excited that I'm joined by a number of presenters I'll introduce in a moment. We'll be talking about sort of how our path on the Strengthening Families initiative has gotten us to where we are right now. We'll share the survey results from earlier this year and the themes that came out of that. Those themes are going to inform some discussion and breakout groups that we'll all split up into. And we were calling them small groups, and then we saw how many of you were registering. But, well, maybe they're not quite small groups, but hopefully still small enough to get some discussion going. And then we want to hear from you about what you think the next step should be. We'll share what we've been thinking and hear from you. Then at the end, I'll share some other updates of recent publications and news from CSSP, which we usually do at the beginning of these webinars, but putting it at the end for a change of pace. So I'm very pleased to be joined by some of the wonderful colleagues who have been part of the steering committee for this work. And I will be handing off to them after I do a little bit of the introduction. We are joined by Jeff Todal and Simone Piper from the Center for the Prevention of Abuse and Neglect at the University of Oregon, Charlene Harper Brown, my colleague from the Center for the Study of Social Policy, Pega Naimi Jimenez from the Center for Public Partnership and Research at the University of Kansas, and Paul Collier from Co-Effect, who also works with Safe and Sound in San Francisco. So many of our partners represented here. We are a good chunk of the steering committee that's been leading this work, and pleased to be able to work together to share our work so far. I wanted to just give a little bit of context before we get started into the current work to explain how we got here. So if you're a longtime Strengthening Families fan, you may or may not have been a part of these earlier steps in the history. You may be aware of them, or you may just be coming to this new. But the development of the framework happened in the early 2000s with a focus really on how we could strengthen families through early care and education. This was an idea that was based on expanding child abuse prevention into new service sectors that weren't stigmatized and where you could reach all kinds of families that had never been touched by or had any contact with the child welfare system. Quickly, when we went into the implementation phase, 7 pilot states started using the framework and seeing what they could do with it on the ground, and found right away that there were partners beyond early care and education who were going to be part of this work, who wanted to use the framework in their own work. Where the initial focus was on early care and education and a bit on how early care and education could better partner with child welfare. But those child welfare systems said, well, we want to use this framework too. We want to start thinking about families' protective factors, not just risks. And then we saw home visiting programs and other settings start to take it on. So in 2009, the name of the initiative changed to just Strengthening Families, which is how most of us know it and have known it for a long time, dropping the specificity of early care and education. And CSSP developed specific tools to help implement Strengthening Families, not just in early care and education, but in home visiting programs and in family resource centers and other community-based programs. We also saw a lot of places start to expand their work on protective factors into health settings, into families, into corrections, so parents who were incarcerated and the probation and parole and corrections officers. Expanding into faith-based organizations and how they could play a role in strengthening families. So broadening how we think about where we find families that we can support them in a variety of ways to build their protective factors. And so now we come to this point in the work where over the last couple of years, we've really started to acknowledge more and more how families and the strength of their protective factors is affected by community conditions, not 100% influenced by community conditions, but certainly affected by them. And we need to think about, one way that I've been saying this is we're asking families to be resilient in really rough situations a lot of the time. And we want to celebrate that families are resilient and can overcome a lot of barriers. But maybe we should also be working on why people have to be so resilient. Why are there so many barriers? So when we go family by family, we really can't get to what it is that can make it easier or harder for families to thrive in the community. And then thinking about the fact that communities themselves can be more or less resilient. So there are neighborhoods that might have some risk factors that you would think would make it a less pleasant place to live, but actually there's a strong sense of community and people really pull together and are resilient as a community. And there are places that don't have as many of the obvious risk factors, but still aren't as resilient as we would think. So there's something happening at the community level, both in how it affects families and just in communities themselves. So this is not a huge leap from what Strengthening Families has always been, which is about recognizing that children don't grow up in programs, they grow up in families and in communities. And this is a quote from Yuri Bronfenbrenner, but it's one that we've often used to help explain why with Strengthening Families, we're saying, if your program is focused on the child, you need to also think about the family they live in and the community they live in order to really help them thrive, and help them achieve the outcomes that you as the provider and the parent and others want for that child. So this is really taking that to the next logical step, which is looking in a more critical way and a more action-oriented way at the community piece of that equation. So we've seen a growing interest in these community conditions that strengthen families, and people define that in different ways. So what you see at the top of this pyramid is the idea of really trying to do community-wide implementation of strengthening families, so that you're talking to every service provider who touches the life of a parent or a child, and you are getting to the pediatricians, and you're getting to the ministers and the rabbis, and you're getting to everybody who's in that kind of role. That's kind of what I would call top-notch strengthening families implementation as we've defined it in the early phases of strengthening families. Then we get to a little bit beyond that, which is thinking about what kind of supports are available for protective factors and what kind of opportunities do parents have to build their protective factors throughout the community, whether that's in a service provision setting or not. What's going on with parks, what's going on with businesses that are family friendly and all of that. And then beyond that, we start to think about community level protective factors, which may or may not be directly related to family protective factors, but are going to affect the well-being and ability to thrive of families, whether they fit into our 5 categories of family protective factors or not. So that's sort of what we're going to hear in the survey results, is the different ways that folks who responded to the survey told us they were interpreting this and what work they were doing. Just a couple more words about how we've been advancing this work. In 2019, CSSP brought together a group that we called Strengthening Families Champions to start developing a strategic plan for a next phase of strengthening families. And community level implementation and community protective factors, both slightly different pieces of what I just showed on that previous slide, both emerged as priorities. And then some of those champions who were working at the local level, just some of the folks you're going to hear from today, and others, started meeting to discuss how to move that particular piece of the work forward. So it's been informal and everybody volunteering as an add-on to their existing job to be able to advance this work. But we've got a great group that put together the survey. You'll see soon what we've done with the survey results and where we want to take the work next. But I just want to take a moment to acknowledge who's been involved in this work. So my organization, CSSP, as the home of strengthening families, and then Safe and Sound in San Francisco, 90 by 30 at the University of Oregon, Colorado's Office of Early Childhood, the Center for Public Partnerships and Research at the University of Kansas, and 2 names that are familiar to a lot of us, Nilofer Hassan and Corey Best, who are both independent champions of strengthening families who have been doing this work for a long time. So that's been our group so far. And I'm very pleased to share with all of you, as the first people to hear about it, that we just released a report and an executive summary, if you're looking for just a shorter takeaway piece, about the survey that we did. So you're going to be hearing the survey results throughout the call today. And I encourage you to share this report with others who might not be on the call today and dig into it. Let us know if you have questions, but just wanted to share those, that they are hot off the press and available for you. So with that, I'm going to hand off to Jeff and Simone to present about the survey itself and the results that we found.
All right, thanks, Kaylin. And if you don't mind advancing the slide, okay? So welcome everyone. And one way to maybe think about what we're about to present, and we'll move pretty quickly too, is that this really is meant to be really a prompt to your thinking for the conversation we'll have. And so we're going to just hit some of the highlights of the survey. And then, as Kaylin mentioned, the report is just issued, and encourage you to take a look at that. It's not exhaustive by any means. And we're really wanting to lean into your thinking and those that you know that couldn't be here today, so that we can build this out. One thing that seems clear is there's a lot of interest across the US to get more clear about what's happening in communities where child abuse and neglect is an exception and not so close to the rule. And so that's the kind of the sentiment behind this. And so the purpose of the survey was to really try to identify community conditions that folks do think are likely to prevent child maltreatment and support families. We wanted to look around at what are the frameworks that exist out there. You'll see in the report some frameworks that were named. We're interested in frameworks that go beyond what we've collected so far, and some that are maybe outside of the usual of folks we engage with. So something that's more multidisciplinary would be interesting. And then this will, and was intended to form really the foundation for a literature review. So that's the sentiment behind the purpose of the survey itself. So, all right, thanks, Galen. And then one thing we'd like you to do here is if you would just drop in the chat box, we'll just take a minute or so with this. But first, if you would just think about a place that matters to you. Maybe it's where you live, love, work. Have a place in mind or a community in mind. And for Simone and I, we're thinking about Lane County, Oregon, where we happen to live. We're about the size of the state of Connecticut. And so we're having a geographic region in mind. Imagine that it's December 31st, 2040. And in this place that you care about, child abuse and neglect is an exception. Imagine that it's lower than 90% lower at that point in time than it is today, whatever your rates may be, if you know them. What happened? And what's happening now in that place where child abuse and neglect is so rare? What are the community conditions where that became possible? So if you would just drop in the chat some of your initial thinking about that. What's happening in that place such that child abuse and neglect is rare and families are connected and supported? So look what's coming in, okay? Nice, thanks y'all. Yeah, keep it coming. One thing that we know in our place is that high school juniors and seniors who have an abuse experience, we've asked them this in some survey work that we've done, nearly half, 47%, said that they've not shared their abuse or neglect experience with anyone at any time, which is a community condition. There are factors that contribute, as you understand.
This is the first time I've done one where I couldn't get the sound going.
So yeah, hopefully we're okay there on the sound. And so that's another kind of a condition. And so be thinking about that too, if you would. So keep it coming, okay? And then let's move on. Caitlin, thanks. Racial equity is being mentioned, a culture of respect for all people, affordable housing. And so keep that in mind as we move through the survey, and keep it coming if you would. So, okay, Simone.
Wonderful. Okay, so just a bit here about our methodology. We launched the online survey in February and collected responses through early April. And the survey included a mix of about 17 closed and open response questions. And the response time averaged about 15 to 20 minutes. A total of 181 people clicked the link to the survey, with about 77 people representing over 20 US states completing it and submitting their responses. And just a few examples of the kinds of questions asked, and a quick note that the full survey is included as an appendix in the community conditions report, so you can access that there if you're interested. So a few examples, we asked participants the same question that Jeff asked just a moment ago, to describe which community conditions are necessary to ensure all families thrive and child maltreatment is prevented. If participants had developed or implemented work regarding the creation of these community conditions, and whether they had developed and applied an intentional race equity action plan in their communities. So then thinking about how participants defined community, we asked them to clearly kind of spell out the levels of community they had in mind in thinking about community conditions that promote child maltreatment prevention and positive outcomes for kids and families. So city or town was most frequently chosen at about 23%, followed closely by county and neighborhood. And this was an area where participants could elaborate on their responses a bit beyond just choosing a multiple choice answer response option. And they were really clear that community truly depends on context, and expressed hope that a community conditions framework will be flexible enough to accommodate multiple definitions of community. So participants indicated engaging with a variety of local partners in their work. The two groups that stood out as the most frequently reported were both service providers and parents. And then you can see a few other groups identified there as well, including agency administrators, stakeholders, and policymakers. And one thing to note here is that nearly all participants who completed the survey stated that advancing equity and addressing disparities was part of their community level work, with 22% reporting that that was actually the driving motivator behind their work. And over half of participants reported working on community level social norms change related to prevention of child abuse and neglect. And 75% had a current initiative in mind that could be supported by a community conditions framework. And just off to the side, here's a brief quote to illustrate that a little bit further. Someone said, "We are currently working to develop a statewide primary and secondary prevention of child maltreatment effort, which includes several community level factors." Many participants expressed hope that a framework will contribute to more effective community level work. And there were three themes that emerged in their responses. The first one was better cross-system coordination. So one person shared, "I believe in order to help all of the children, there needs to be better collaboration between everyone that works with children. Right now in our area, and many others I'm familiar with, we all operate independently as opposed to working together." So there were sentiments of kind of siloing work that I know a lot of us are familiar with. And then another key theme was communicating more effectively. So one person stated, "Community level protective factors would provide us with a language to clarify the distinction between individual or child and family protective factors versus community supports that are necessary to build up those protective factors." And the third theme was really around shifting the focus from intervention to prevention. So one person stated, "One of the functions of community protective factors is to help us answer what are some of the solutions to child abuse in a way that is more oriented to prevention as opposed to response." And then I'll hand it over to Jeff to discuss the additional themes that emerged from the survey.
Great, thanks, Simone. Yeah, thanks everyone for the comments in the chat. If you would, keep them coming, okay? So you notice what folks had entered into the chat. So this really are the four themes that emerged from the survey. And so you'll notice much of what you've been saying in this particular visual here. So people talked about, like many of you have been saying, essential and basic needs, vital. That's what's occurring in the community. Those are vital conditions where child abuse and neglect is rare. Social support and connection, social contract, and then racial and social justice. And we'll just dive inside of each one of these very briefly. And again, it's in the report, and we'll share just a few details again. So, okay, Kaylin. And so around essential and basic needs, just if you would just take a look at this, it's what many of you have already said. Families must have stable, safe housing, access to healthy foods and healthcare, and enough funds for day-to-day needs. Folks talked about high quality early learning, food security, economic opportunity. And then social support and connection. A lot of folks talked about this as kind of like an interpersonal currency. High levels of cohesion, community level readiness. People feel connected. This place is for me, I belong. And then around the social contract, a lot of comments around social contract, social connection. This one, though in particular, was about really the notion of really transforming the social contract. So there must be a social contract whereby communities encourage in multidimensional ways high-level prevention efforts and messaging, restorative justice practices, and a culture of looking out for one another. A lot of folks were saying there's a need to fundamentally change the way in which we think about community. And then racial and social justice, which Charlene will elaborate in detail here in just a moment. So really, people talked a lot about anti-racism work that was highly commented on. For instance, Charlene, I've heard her say that race isn't a risk factor for child abuse and neglect, racism is. And that kind of idea showed up a lot in this report of those that we interviewed. And then just finally around social justice and anti-racism, a community willing to change, to unite together for the sole purpose of bettering the community where they live and where their children go to school, a place that provides medical needs to all and a place that is diverse and more. So there was just a lot about that. So those were the 4 categories that emerged, really very consistent with what many of you were saying in the chat box.
All righty. You want me to jump in, Kaylin? Okay. All righty. We're going to the next slide. We're going to the next slide. Okay, here we go. I really appreciate the last statement that was shown, the survey respondent statement about what social justice is. When they said that it's a community that's willing to change, to unite, to be diverse, to be safe. But as strong and important as this statement is, it's a statement about the outcome of social justice, what a community looks like if we work to achieve social justice. And so what I want to suggest is that we need to extend this understanding about social justice to beyond just the outcome and conceive it as a composite of various different processes, intentional, active processes that must include what you're doing to achieve social justice. And I want to suggest just 4 different processes that are important in this intentional active process. So one, seeking equitable access for all to various different things like opportunities, equitable access to opportunities like leadership and power, to resources like quality schools and housing and employment and a safe and clean environment. Equal access to equitable access to services like health care and what goes on in the court systems, and intentional equitable access to responsibilities like voting and protecting basic human rights and valuing inherent human dignity. So that's one thing, one process that has to be a part of social justice. The second process is challenging all forms of oppression and injustice, from racial oppression, gender, sexual orientation, religious oppression, ability, etc. But challenging all forms of oppression and injustice is a part of social justice. The third thing is promoting context, creating and promoting contexts and experiences that enable all people to thrive, like removing obstacles such as poverty and discrimination. And then fourth, building social solidarity and community capacity in order for folks to work together to make a change. So that's how I'm conceiving social justice. But now I think the mid part of that triangle that you all just saw said racial and social justice. And I want to say why that is and give a definition of racial justice or racial equity on the next slide. Even though social justice processes include changing all forms of oppression and injustice, it is important to give particular attention to racial and ethnic justice, because numerous studies show over and over again that irrespective of class, gender, and other identities that people have, that race matters with respect to disparities in treatment and in outcomes. So focusing on racial justice is particularly important. So racial justice is commonly defined, if you look at this, this definition up here, that racial justice is commonly defined as a condition that would be achieved if one's racial or ethnic identity no longer predicted a person's outcomes. But once again, this is about outcomes, not the processes that are necessary to achieve racial justice. So racial justice, racial and ethnic justice is about both working to eliminate discrimination and inequities and working to advance deliberate systems and supports to achieve and sustain racial equity. And so this includes the elimination of policies and practices and programs, cultural messages that reinforce different outcomes about race. And it also includes addressing the overarching ideology that perpetuates and sustains racial inequities. And that's what I consider to be racism. So I want to use an analogy here. As evidenced by the alarming number of preventable deaths due to the current pandemic, failing to intentionally and systematically take precautions to contain a disease allows it to flourish. When you don't do anything about it, it allows it to flourish and persist. So the analogy is that failing to address racism will also allow it to flourish and persist. And so our quest for social justice, for racial justice, is just going to continue to be elusive if we don't systematically address it. So what is racism? I want to use a definition that a public health expert, Camera Phyllis Jones, issued. She defines racism as a system of structuring opportunity and assigning value based on the social interpretation of how one looks that unfairly disadvantages some individuals and communities and unfairly advantages other individuals and communities, and therefore saps the strength of the whole society through the waste of human resources. So why is this important? Well, I want to use CDC's 4-level social ecological public health model to better understand racism, because the way this social ecological model considers the complex interplay between the individual level, the relational level, community level, and societal level, and how those factors in each one of those levels put people at risk for poor outcomes. So I want to describe what I'm calling the social ecological model of racism. And one of the good parts about using a social ecological model is that the rings that overlap illustrate how factors at one level influence factors at another level. And it also suggests that how important it is to act across multiple levels of the social ecology at the same time. Operating in just one is not going to be sufficient to completely eradicate whatever the issue is, whether it's violence or whether it's racism. We have to operate at all levels of the social ecology. So when I look at racism, and I'm sure you've heard this before, but I want to frame it in this way. When we talk about individual or intrapersonal racism, we're looking at it from two different perspectives. When you are the person that's carrying these racist ideas toward other people, that's what individual racism is these particular beliefs and feelings that individuals have that support and perpetuate racism in either conscious or unconscious ways. It's all right to talk about your unconscious implicit bias, but there's also this very conscious things that people do that end up being racist as well. So that's like from the other person toward people. But also individual racism, intrapersonal racism happens when individuals themselves accept and internalize the racial attitudes that people have about their particular group, and they take on those attitudes about their own group and somehow separate themselves from the group. So that's that intrapersonal individual racism. This next level is interpersonal or relational racism. Now, when people bring their private beliefs, their private attitudes, and their behaviors into interactions with other people, then we have this interpersonal or relational racism. These things like racial profiling, discrimination, racial slurs, jokes that people tell, and this thing that called microaggressions, that if you are the victim of a microaggression, it doesn't feel rather micro at all. So whoever created this term, and I do know who created the term, was not a person who had been microaggressed at. Let me put it like that. So it's not small. The impact of a microaggression is not small. It is macro. It's big and it hurts, particularly when it happens over and over and over again. The next level of racism across the social ecology is institutional or community racism. So the ways in which this focuses on the ways in which there are discriminatory practices and policies within institutions, like in schools and housing, businesses, and the services being treated unjustly and without dignity when you're trying to receive services and resources. All of that relates to institutional or community racism. And then finally, at the larger level is a systemic or societal racism. And these things refer to factors that sustain or transform a dominant social climate. So the history that's been a part of a particular culture, the laws, the policies, the values, the norms, the culture, the public images that are presented about groups of people. All of that is part of systemic racism. And one of the things that we know is that the societal level, as you see, which is why it's painted bigger, the societal level affects all other levels of the social ecology. So if we can begin to really, we need to do all levels, but if we can begin to impact systemic racism, it can permeate, change people's values, beliefs, policies, laws, reject various different public images and representations of people and lack of opportunity, then it can begin to affect or permeate all the other levels. And so what is a response to racism? Well, one particular response is taking an anti-racist stance. And not only just taking the stance, but it's on the next slide, please. It's normalizing. It's not just saying, I'm anti-racist or I'm taking a anti-racist position. It's normalizing an ideology of anti-racism. Anti-racism must become a core value and involve intentionally a core value here in the United States and across the world, globe, that involves intentional, meaningful actions that people do to address racism. It's a commitment to ongoing learning and long-term transformation, because many times people don't even recognize the racism that they are participating in. So learning about the history of racism in all its various different forms, examining the historical roots and contemporary manifestations of racism is extremely important in general and in your particular context. Identifying the racist roots of various different policies. All of these things are very, very important when you try to normalize an anti-racism position, in order for you to develop the community, individuals and their community, to develop transformative policies and procedures that will lead ultimately to sustainable change. And so that's my contribution to this community conditions. I want to end with just looking at this last statement here. When we choose to become, and it is a choice, when we choose to become anti-racist, we become actively conscious about race and racism and take actions to end racial inequities in our daily life. Being anti-racist is believing that racism is everyone's problem, and we all have a role to play in stopping it. There is no neutral. You're either anti-racist or racist. Okay.
Thank you so much, Charlene. I think most of us on the line agree we could listen to you talk about this for an hour. And so thank you for being so concise and sharing so much information in a short time. I'm going to hand off to Pega.
All right, hello everyone. So you can go ahead and advance to the next slide, please. So I wanted to remind everyone of the themes that were just discussed that we found from the survey. As Charlene did so beautifully, you know, there is a common thread from the themes of essential basic needs, social contract, social support and connection, to racial and social justice. So as we're thinking about this, we're really looking at it as an interconnection too. So what we would like to do for the next 20 minutes or so is we're going to break you all up into smaller breakout rooms. There will be a facilitator in that room, and we want to hear your thoughts. We want to have a little bit of interaction about what you think of these themes, and to discuss that together in I should say, smallish groups with one another. So you'll have a facilitator. We're hoping to have a note taker who will volunteer from that group. Paul is going to include a link to a Google Doc that we've already put together so that we can actually type right into that Google Doc, and everyone will get to see those notes that get put together in our small discussion groups. And then we'll come back together as a larger group and share out what we've heard so that we can get a better understanding what you all think, and maybe also where some gaps are. So you'll be assigned pretty soon here into your groups, and we'll come back together after.
time felt so short.
It did. We had to shorten it a little bit so that we'll still have time for the rest of what we want to cover today, but I think we know that everybody wants more time to talk about this stuff.
Now, Kaylin and Charlene, I know I'm an over talker, but that was
I tell you. Oh my goodness. Yes, indeed. Uh-huh.
All right. It looks like not everyone is back yet. But Pega, I think maybe we should soldier on.
Yeah, that sounds fine. Will the presentation come back up? Am I missing it? Perfect. Great. Okay. So in the small groups, these were the 4 questions that we had asked, and we just want to get a bit of a share out from some of you and what you discussed in your group. So I'll just start with the first one, just so we all can hear what's happening in your communities that was related to the theme that you discussed in your groups. We'd love to hear from some of you. And facilitators, if you want to share on behalf of your group, you may do that. We would love to hear other voices as well.
Pega, our group was talking a bit about social connections. And there were some really great examples of, I think in many folks' communities, organizations that were, say, providing food, coming together and rallying, bringing their volunteers together to provide that in new ways. And really sort of be innovative and answer to that need and meet people where they're at in this crazy time. The other thing, and I wish I could remember who mentioned it, feel free to mention the chat. They said, in Georgia, where they live, the vote, Get Out the Vote campaign has really built a lot of social connections between neighbors and convince people that might not otherwise connect to connect. So those were just 2 things that I wanted to highlight from our discussion.
Yeah, that's great. I can definitely see that Get Out to Vote being a big mobilization there. Great, thanks. Any others?
Our group talked out quite a bit about parent voice and really the importance of making sure, the different efforts in communities to sort of embed that or incorporate that at multiple levels. And also to open the conversation and just build confidence in parents in sort of talking about issues of culture, issues of racism, along, with other challenges that they might be facing. But that's a conversation that often gets closed down or isn't comfortable.
Yeah, absolutely. Parent voice is really crucial here. Thank you. Great. So there's, one more that I'm really interested about. Our group didn't get a chance to dive into deep. Hopefully others did. But I'm curious to know if there were other conditions or factors that you all discussed that maybe weren't represented in the themes of the survey, and what some of those were that you highlighted. What was missing?
Hi, everyone. This is Francie. I'll share something that I wouldn't necessarily say was missing, but I think maybe we wanted to sort of elevate it, which is some of the strengths and responses in more recent immigrant communities and some of the qualities around mutual aid and self-help support that are often present there. I hope I'm doing my group's comments justice, but I would say that was a theme that certainly can be embodied in what you shared, but I think maybe we were just trying to give it a little bit more emphasis and attention in this current context.
Yeah, I really appreciate that, because I think immigration is a really important it's a really important thing that's happening in our country now. And I think it does affect a lot of our families, for sure. So thank you for bringing that up. Any others to something to elevate or something to fill a gap?
Now, I thought a comment in our group, and it was a rich discussion. It sounded like others, we were just getting rolling, you know, and someone made a comment around you can't have a fear-based environment to get toward this kind of change. And the comment was, families can't fear that. And then what follows that could be so many things. Families can't fear that. And so working to dismantle the reasons that contribute to fear and which then can also create disconnection. So I think a lot of what Charlene was talking about relates to that comment too. So I thought it was a powerful thing to reflect on.
So I just wanted to really be, I wanted to elevate something that came across in our conversations that may not have been intentionally considered while extracting the themes, and that was the explanation of social contract. So this came from a Latinx worker who says, you know, her people would not understand just looking at that, what that means. So that may be something that was left out or missing. And I think that we have a lot of opportunity to understand how we might be able to lean into the cultural sensitivity of antiquated American ways of delivering messages, right? So that was one piece. And the other was not that it was missing, but it was interesting to see on the anti-racism and social justice piece, this theme of the legacy of patriarchy and paternalistic systems, back to Charlene's presentation, right? How that really impedes the work of creating social contracts, because from a worker perspective, to some degree, you have this quasi power, and we're indoctrinated in seeing people at their worst, right? So we're trained in this way, and it's an adaptive process to be able to build this authenticity with those who may be more challenged or have more critical needs than you and I. So I thought that was interesting.
Absolutely. Thank you for sharing that, Corey.
Well, I just want to build on what Corey was saying, and although we didn't get specifically to the question in our group, one thing that came out, and I'm looking back at the notes, is this idea of attitudes and norms that are perpetuated through the social service industry group, through those who provide social services. So that these attitudes and norms that may be grounded in racism, or may be grounded in sexism, or may be grounded in other isms and biases, that the need to address those to develop this community that really supports all children and families is important.
Yeah, and I think what this is highlighting for me, from what you just said from Corey and what Kaylin is picking up on, is this intersectionality piece of this, and how patriarchy, class, race, and the lack of, you know, all of it, I think really does interconnect together, and having an explicit awareness of that as we go into this work. So thank you for that conversation. I do want to move ahead, so we do have some time in exploring, you know, what the next steps are. So just to summarize a bit that came out from the survey that we pulled out for our conclusions and discussion, you know, one of the things is that these themes that emerge are important for everyone, and not just for families and children, right? If we think about a community, it really is, you know, we're seeing these community conditions as a public good. In order to set up individuals and families up for success, we really have to think about that complete unit. And also thinking about it in the ways that it's affecting historically marginalized groups. We really do have to center that as a part of the conversation. What we're also, you know, what came to be really apparent, and I think our conversation is showing that too, is that the community factors are interrelated and mutually reinforcing. So if we think about this in the example of supporting equitable access to basic needs or support, it is also supporting racial and social justice, right? We can't think about these things separately. They really do work together. So if we think about the bidirectional relationship then with all of the other themes and racial and social justice, it leaves us considering that maybe it's useful to view child maltreatment as a social justice issue rather than just a public health issue that it's been traditionally thought of. So as we're seeing this theme with how this is related to racial and social justice issues, I invite us to think about it in that way too. And then of course, I just wanted to bring us back to how might these community protective factors framework, how might it help? And we talked about this as the results were being discussed, but we heard from people in the survey that it would help to coordinate across systems. So, the social network within our organizations having similar issues and being able to identify that would be really key if we had a framework to address it. But also the effective communication that would happen, right? If we can together, as we're trying to do right now, build a shared language and shared understanding about what these community conditions could be, how effective that would be in our work. And it would also help to tell a more comprehensive story about child maltreatment beyond just individual families, but also what is the role of the community that plays into this. And I think that that's really important to consider. And then of course, I think many of us have this on the forefront of our brains, is shifting from a focus of intervention to a focus of prevention and promotion. So again, prevention focused solutions and promotion of families thriving, again, needs to be that center as we're thinking about how this work could help. So Paul's going to take us into the next section of talking about what the next steps could look like.
Awesome. Thanks so much, Pega. You can advance to the next slide. Lovely. So, so the last piece here we wanted to talk about are what are our next steps with this work? And you're not off the hook yet, because right after this, I'm going to ask you what you think are some of the potential next steps we should be considering. But I did want to share, what we as a steering committee have thought about in terms of next steps so far. So of these, the first is really, finding resources to support this. We need to do some fundraising. We need to continue identifying partners that can help us advance the learning around community conditions that support families and children. So that's a pretty foundational one. That allows us to then continue our learning. So we know that we need to engage a little bit more broadly. My dog says hi, by the way. But we know that we need to engage a little bit more broadly for folks that are beyond just the network that we have here on this call and are beyond the folks that completed that survey. We received feedback from folks who are typically in the Center for the Study of Social Policy Network, but we want to look more broadly to people who maybe are community organizers, neighborhood groups, faith-based groups, social and environmental justice advocates, and of course, parents and community members to get input on, what are the conditions and how can a framework help support work that advances those in all communities. So, this webinar was an important contribution to that. I love the diversity of thought and perspective that was here today. And so hopefully we'll begin to do more of this soon. And then we've also considered doing a literature review and sort of diving deeper into each of these themes so that we really understand, what research has already been done in each of these areas and ties each of them together. And then, of course, there's a share out step. So there's a more, I think, concise and comprehensive community protective factors framework that we'll be looking to publish once we can do a little bit broader learning. I think what we've got here is a really excellent start, but it's certainly just a start. It's not the end of the road. And we've also discussed really creating or identifying a policy agenda. So naming pieces of legislation or policies that we think can support these protective factors across different communities. So that's our thinking. If you want to flip to the next slide, would love to just, maybe spend a few minutes hearing, what steps do you think, where do you want this work to go next? And with that, would love if you want to type in the chat, or if you'd like to come off of mute and just share, maybe your thoughts on what would you like to see happen next with this? How would you like to be involved? What additional guidance might you need?
Good afternoon. This is Lou Scott. I'm with the Milwaukee Operations Section of the Department of Children and Families, and I had a heck of a time trying to get into the conference, and I was glad that I was finally able to download the app and a whole bunch of other stuff. But it's been very interesting in hearing everybody's perspective. And in Milwaukee, I think our biggest issues are connectivity, connecting with each other, breaking the barrier, that red tape barrier that keeps the communities and the different departments from speaking with each other. And so I think that one of the things that I would love to see is that Red Cross broken, that barrier that keeps us from talking to each other so that we can be more effective and stop duplicating services and align our services so that we can be more effective and more proactive.
Absolutely. Thank you so much, Luz. Couldn't agree more. I see some coming through in the chat, which is great. It would be great if there was a crosswalk between this framework and the CDC Essentials for Childhood framework. And absolutely, we've thought about too, we need to make sure that we don't have a sort of framework overload situation on our hands, so folks don't get lost. Any other thoughts that folks have in terms of potential next steps and where this goes next? Love what I'm seeing in the chat. So I know that we are under a little bit of a time barrier. So with that, why don't we, if anybody has additional thoughts on potential next steps, where would you like this to go, and how would you like this to get involved? Put them in the chat as we move into our next section, which is a little bit of ending material. And I believe, Kaylin, this is you.
Yes, thank you, Paul. And thanks everyone for the thoughts you're sharing. This, as Paul said, the report from the survey is just a first step in this process. That's still a bit of a path to go in this webinar. Getting all the input from all of you is a really important step in it. So thank you for helping to inform the work going forward, and let us know, how you want to be connected. Just put that in the chat box, and we will be thinking about ways to continue engaging all of you and others. So I just want to share some updates from CSSP, as we often do at the end of these, somewhere in these calls, because there's a lot of other work going on at the Center for the Study of Social Policy that's very related to this community level work. And so a few things I want to share. We just released a new anti-racist policy platform for early childhood, which I love it. I want to share it with the whole world. It is called What We Owe Young Children, and it goes through, I believe, 10 broad policy movements that should be happening in order to truly support families with young children and to undo the damage of the racist systems that have been set up in this country throughout its history and that persist to this day. So please check that out. Jang put the link in the chat box, and you will get these slides and be able to see the get the link from that as well. We also just released a paper called Moving Beyond the Family Engagement Checkbox, an innovative partnership to promote authentic family engagement and systems change. This comes out of our work on pediatrics supporting parents. So the paper describes a process of true, authentic parent engagement in partnership with the group Family Voices that brought true parent voice into thinking through what pediatrics and other healthcare providers and parts of the health system can do to engage parents. And we know, I think everyone on this call knows exactly what we mean by the family engagement checkbox, which is, yep, we talked to a parent, we got that input, now we can check that box and move on. But this was really a fabulous example of a much more authentic process where parents were really honored and valued as decision makers and helping to shape some systems transformation processes. So I encourage you to check that out. They also did a webinar about it. That might have been last week, but it's hard to say. It's the way time is going these days. But if you go on our website to find that report, you can also find the webinar that they did about it and watch that recording. Also, this fall, we put out a series of briefs about how early childhood systems at the local level responded to COVID-19. So that's a series of 3. One is about how some of our EC Link communities, which are communities that are part of our network called Early Childhood Learning and Innovation Network for Communities. So those are communities that are doing a lot of intensive early childhood system building. So we wrote up a brief about some of the ways that they responded when the pandemic hit. We also have one about our Dulce settings in particular. Dulce is a program that's based in a pediatric clinic, which engages a family support specialist with a family every time they come in for a well child check up to the first 6 months or through the first 6 months of life. And so a paper about how those Dulce settings continue to serve families as the pandemic unrolled and changed a lot of processes. And then in particular, there's a third brief that's about how the Children's Hospital of Orange County continued working with parents of infants during the pandemic through their Dulce implementation, but specifically for that children's hospital. So I encourage you to check those out. And I wanted to share that all of CSSB's COVID resources are on one place in our COVID clearinghouse. And I encourage you to go to our website and look for those where the 3 briefs that I just shared have been added since I took the screenshot of what's listed there. It's a growing list, and we encourage you to add that. Typically, we also have updates from the Children's Trust Fund Alliance, our partners, but they're actually offering a training of trainers today, and so a virtual training of trainers. And so they're not sharing updates today, but they have a lot of great work going on as well. And so we actually do have a few more minutes if folks want to stay on and continue the conversation about these themes. I see there's still some really good comments coming in the chat. Otherwise, we can let you go a little bit early. If you want to stay on for conversation, please do. And otherwise, I will put up our contact information. So those who are just joining us for the first time, please check out our work and continue to connect with us on these conversations. And otherwise, I think maybe among our steering committee members, we can see if there's any themes that we want to continue drawing people out on, because we have a little bit of extra time.
What would be the value add? We didn't get to that, but I don't know if anyone else did.
Yeah, we talked about it some in our group about what would be the value add of having a community protective factors framework. So I'll say from my group, one thing someone shared was that it might help to coordinate across all the various initiatives that are going on. This was someone speaking from New York City, where in particular, there's a lot going on, and it's not always easy to coordinate across all those partners. And so I heard it as in the same way that the Strengthening Families Protective Factors can help providers kind of be on the same page about what they're doing with families and why, a community protective factors framework could serve that purpose more broadly to say, here's what we're working on, and it contributes to this, achieving this or that community protective factor. But I'd love to hear what others think about that if you're able to stay on. So that question was, what would be the value add of a community protective factors framework if we were to develop one?
Well, Kaylin, I'll jump in. I think one of our challenges here in Idaho, I mentioned in my small group that we have what we call our community of practice, which is Hope Conquers ACEs, health outcomes from positive experiences can conquer the adverse childhood experiences. And we've been quite successful in reaching out to lots and lots and lots of different agencies. Not me personally, I train the trainers who then go out and basically any place that will let us in, so we've been in prisons, in hospitals, in schools, in churches, and just introducing the protective factor framework and trying to get that language, the protective factor language being sort of a umbrella that family serving agencies can use to talk to each other. So that's been lovely. But we feel like we're at that first rung. We're at the education part of it. We haven't yet gotten into, you know, okay, so we come in, we do these presentations, maybe we go back one more time, but is it being integrated into the way they actually do their work? And maybe having some sort of a survey would help us to know what to aim for, you know. So yeah, we would love to have anything else that's developed.
Thanks, Maureen.
I would just echo that. I put the comment in about evaluation, and I think the protective factors framework really, I mean, it was used for so many things, right? It ultimately has led to sort of that protective factors survey that has been used and rehashed, and it gives us a way to really measure our work and say that what we're doing is effective. And that's the part that we've really struggled in Iowa with community level stuff, is that how do we measure it? How do we say that we're making any difference? And if we have a framework and we can build on that to start to say, we are seeing these things associated with either, you know, whether it's racial justice or whether it's economic stuff change. So for me, it would be so critical to be able to evaluate our work.
Great point. Thank you, Lisa. Others?
I'm seeing I'm fascinated by Charlene's elevating equity as both a process and outcome. And so, you know, when we read these executive summaries, not necessarily this one, but the equity approach, the 5 phases of equity practice, the 1, 2, 3, we often miss the process of building a collective. So I think a part of the opportunity and also challenge when it comes to value add, I think a community protective factors framework puts us in a position to begin to elevate and begin to measure the process it takes to get to a community that can acknowledge that these values are existent and they can validate or testify to the fact that they're present in their community, that it's not just an organization saying we have adopted a framework and we've extracted a tool and we've checked a few boxes with a few indicators. So I think the process of relationship building, the process of organizing around these community protective factors, level 2020, right? I think that there's opportunity that we can begin now to measure even this conversation is a part of that process. And what do we take from that to be able to tell others, maybe at a meso or micro level, how to do that and what the process looks like to help really accelerate that change that we're looking for.
Thank you, Corey. Anyone else want to jump in?
It's hard to follow that. But I think one of the things that we often talk about when we also do community presentations anywhere and everywhere that will have us, but we often talk about sort of resilience as the individual answer to ACEs and trauma and all kinds of things, and the protective factors as sort of that family. And then this is the next step up, the community. And it's those circles that Charlene gave so beautifully about racism. There's work at all of those levels that has to happen. And the better you can explain it and show people where they fit, more people can fit themselves in. It's one of the things I love about the 90 by 30 is the website where you say, you know, what's your role in the community? Here's your role in child abuse prevention, helping people find their role.
Hmm.
Thank you, Angela. Well, I'll leave a little bit of silence here in case anyone else still wants to jump in. I heard you're supposed to leave 17 seconds, but I just can't do it. So I think I just am so grateful for everyone who joined us, for everyone who facilitated the small groups, for the steering committee that's been driving this work forward, and for the reports that we were able to, the report and executive summary we were able to get out today. Very, very grateful for everyone's work on this. And we will look forward to continuing this conversation with all of you. We will definitely be in touch in a variety of ways. Enjoy whatever holidays you celebrate this time of year, and hopefully some peace and tranquility at the end of a rough year. And we will be in touch soon. Thank you all.
Thank you.